We're back with Nicole Tutton and Deb VanderGaast, both candidates for state senate in Iowa. Nicole, you spent part of your career helping people through the process of signing up for health insurance, the Affordable Care Act. Deb VanderGaast, you're a registered nurse, so both of you have ties to healthcare, support making healthcare more affordable in Iowa. I guess, how does it get done? What changes of legislation would you pursue if elected? You first, Nicole.
Well, I would make well, that's kind of a federal thing, but I would certainly try to promote more accessible health care, especially mental health care parity, because Iowa is 46th in the nation for child health care. That's reprehensible. Our children are going through so much right now, and we're 46th in the nation. We're 51st in psychiatry beds for adults. That is, what? 51st. There's 50 states. We're behind, we're 51st.
How does it get done? What would you pursue?
Well, I think one thing we can do in Iowa is reverse the privatization of Medicaid. Unfortunately, that has made corporate profits for insurance companies take priority over care for patients. The other thing is that we need to ensure that if there is federal expansion of Medicaid to more people, we need to ensure our state participates, because they did choose to not participate in some of the Affordable Care Act. So we need to make sure that the citizens of Iowa can access programs that are made available to them.
Both of you also have experience dealing with children and their families. Deb VanderGaast, you're the director of a child care center for kids with special needs. Nicole Tutton, you've been involved with the Iowa Autism Society. Is Iowa doing enough for kids with special needs? If not, what do you think should be done differently? We'll start with you this time, Deb.
Well, especially in rural areas, no, they are not. Most of the focus of services for special needs tends to happen in the school, and so outside of school hours and during the summer, many of those services don't happen. I actually used to be a Medicaid waiver provider at my center until Medicaid changed the rules and dropped child care providers, and sadly at that time I was the only children's mental health waiver provider in the county. We need to better use what resources we have out there to provide services and have more service providers in rural areas.
Nicole, you mentioned at the top, one of your big reasons for running for state senate is that you have a child with special needs. What would you do differently? What needs to be done? What kind of changes would you pursue?
Well, more needs to be done for special needs kids. The Medicaid waiver program pays its workers $8 and $10 an hour. That is not enough. $16 is the bare minimum for a single person to live in Iowa, and it's ridiculous. $8 an hour. My son currently is on one of the Medicaid waivers, and because he requires special needs that insurance does not pay for, and unfortunately he receives no services. None. There are no providers in our area because of the low wage scale. So thank you very much, State of Iowa and Terry Branstad. I want to thank you so much from the bottom of my heart, because my child is going without health care.
Let's move to the next topic. We're going to stick with the children's issues here. A new law adopted in Iowa this year eases the rules on child care. One individual provider can now oversee more 2- and 3-year-old kids than they did in the past, and now 16- and 17-year-olds can work in child care centers without being supervised. Supporters say it helps child care by opening more spots for kids, better access in that regard. What about this approach? How can child care in Iowa be improved? I know both of you are passionate about this issue as well, but Nicole, you're first this time.
Oh my gosh, I think that is a bad move. It is going to fall. I mean, our DHS workers are stretched thin enough the way it is, but this is putting more responsibility in the hands of workers that, like I said, are being paid $8 and $10 an hour. Child care workers are making $8 and $10 an hour. They're underpaid. They are, you know what happens when people are underpaid, and they are now being forced to have more responsibility with our kids. It's a bad idea. It's got bad, bad, bad written all over it.
Deb VanderGaast, you're in child care directly right now. What do you see from this?
I was actually on a work group for the governor's task force that made that recommendation, and I did not agree with it. First thing when they released that bill, I told my staff, I won't do that to you. Please don't quit. Because what this is doing is, instead of the government taking on solving the child care crisis, they're putting more burden on the child care workers. And they're already the #1 subsidizers of child care. It's a bad idea. I, as a director, will not do it. So I'm going to keep my kids safe, and my staff, I am not going to expect them to take on more work. They already work so hard for so little.
We step away from our conversation one more time. Still ahead, public schools. The governor loses out on private school vouchers again, but not likely to give up on it, where these candidates say the focus should be. For the record.